We begin tonight with a medical breakthrough on two fronts. The World Health Organization has just approved the first ever vaccine to prevent malaria. In Africa, this is a life and death breakthrough that finally puts the odds of survival in favor of the children. Most of the people who catch and die from malaria live in Africa. Most are under the age of 5. Scientists say that malaria is far more deadly than COVID-19 in Africa, killing more than 380,000 people in 2019 alone. The head of the WHO calls the vaccine a gift to the world and is urging vaccinations to start across the continent immediately. Now, clinical trials were carried out in 7 African countries. Here is more from the WHO's Africa director.
We've long hoped for an effective malaria vaccine, and now for the first time ever, we have such a vaccine recommended for widespread use. Today's recommendation therefore offers a glimmer of hope for the continent. We expect many more African children will be protected from malaria and grow into healthy and productive adults.
I want to pull in now Ashley Burkett. He heads malaria programs at PATH. That's a nonprofit organization focused on global health. He joins us from Seattle in the U.S. It's good to have you on the program. How much of a boon is this vaccine for the global effort to combat malaria?
Well, this is huge news and a huge step in the fight against malaria. We've seen a lot of progress over the last 20 years or so, reducing malaria deaths from over 1 million to under 500,000. But we're still seeing over 250,000 young African children die from malaria every year. And our progress has stalled. Really, the last 5 years, we haven't been able to reduce that number. So we really need new tools to bring and use in combination with the existing tools to continue to drive down the burden of disease in Africa.
And is it realistic to expect vaccinations against malaria now to roll out across the entire continent immediately?
No, it won't happen immediately. So the vaccine has been piloted in 3 countries, in Malawi, Ghana, and Kenya over the last several years. Very encouraging data on the safety of the vaccine, the effectiveness of the vaccine when it's delivered through routine immunization programs, which are very robust in sub-Saharan Africa. Often 80% of children are receiving their vaccines. So we saw that slotting a malaria vaccine into that existing infrastructure can really be quite powerful. But it's going to take time. It's going to take time to ramp up manufacturing of the vaccine to higher levels. And first, the next step is really to ensure that the financing and the money available to buy these vaccines for some of the poorest people in the world becomes available over the coming months.
And does this vaccine mean, though, that we can now finally realistically talk about a time, maybe in the near future, when malaria will be completely eradicated from Africa?
I think it's premature. With over 400,000 people still dying, and as I said, 250,000 children, the primary focus is driving down the disease and death. We've got to get those deaths down to 0. We've got to see a day when no children are dying from malaria anymore. And then we can start thinking about ultimate eradication. We're eliminating the parasite from some countries. Certainly we're having success there, but still over 70 countries have the parasite, and many countries, the primary goal is to decrease those deaths down to 0 first.
And Ashley, let me ask you, the rush to get COVID-19 vaccines out around the world, did that have an impact at all on getting this malaria vaccine developed and approved?
I don't think so. This has been a 30-year endeavor. This pilot introduction was started before the COVID pandemic. We definitely think a lot about equity when we think about COVID vaccines and making sure we're getting those vaccines to people that need them around the world, not just in rich countries. One of the challenges with malaria is this is a disease of the poor. We don't really think about malaria every day here in the US or certainly in Europe. So we're really advocating on behalf of those children without a voice, those young African children under 5 who are going to benefit from this vaccine. So it's very different in terms of the challenges to keep the focus and bring something like this, a new tool like this, to the brink of potential impact in Africa. It's very different to COVID. But today's a historic event and a really important step along the way.
Yeah, and it's good to be delivering good news for a change. Ashley Burkett joining us tonight from Seattle. Ashley, we appreciate your time and your insights. Thank you.
Thank you.